Hey y'all, this is Dr. K Mack here. I am a licensed clinical psychologist and I wanted to talk to you all about seasonal affective disorder. Now, if you have seen the other video prior to this one, I talk about it's cold outside, it's dark, it's raining, and the last thing that I wanted to do this morning was get up and go to Pilates. And that's what may happen for a lot of people when we think about the winter months, especially when you're in a place that gets all the seasons. You have less daylight hours, it gets colder, it gets darker earlier. Even when you wake up, it's dark. And for many of the clients that I work with, they talk about when I leave for work, it's dark, when I come home, it's dark. And a few things may happen with that. One, you may notice changes in your mood. So, it's dark, it's colder. We want to naturally hibernate. We want to stay inside where it's warm, which means you might not be doing the activities you normally do. You may not be connecting with the people that you normally connect with. You may not be exercising as much as you normally would. And you may not even be outside as much. And that vitamin D, that outside, those activities, those connections are all important factors when we think about our mental health and wellness. So what are some of the common symptoms of seasonal affective disorder? We want to think about some of those major categories. Are you sleeping more or less than you normally would? Are you eating more or less than you normally would? Are you doing less than you normally would just in general? So I'm not going out, I'm not hanging with my friends, or even if they invite me, I don't go. And here's the kicker. For some people, they may do these things and it's like, well, all right, I'm still not enjoying it. I'm still not having a good time. It's still not as pleasurable or enjoyable as it normally would be. Other symptoms you want to look out for: irritability. Now, this is one where sometimes people, you just may describe someone as like, oh, they're snappy, or it doesn't take anything to set them off, or the slightest little thing may make you more irritable or reactive, or you're noticing that your patience has changed. Pay attention to that. Are there changes in your focus and your concentration? Is it harder to read a book or watch TV? For some people, they may say, I read something, then I have to go back and reread it because I don't know what I just read. When we think about those other symptoms that sometimes may go unnoticed, it may be changes in your hygiene, your health, how you're taking care of yourself. So it's like, I'm not wearing the clothes I normally would. I'm not getting dressed up. I'm not taking care of myself. Maybe for guys, I'm not going to get a haircut as normally as I often would. The weeks are spreading longer in between. For women, it's like, I don't really care about my hair. I don't really care about my nails or whatever. So it's just these signs that something isn't your norm. And when we think about seasonal affective disorder, as much as it may come in during those colder months, so I start noticing people around October, November, especially right now, December, people are saying, hey, something is off. Is this winter blues? I'm noticing a change. It's taking me more effort to do the things I normally would do. Or on the other side of that, you do things and it's like, I am exhausted and I didn't even do as much. So with seasonal affective disorder, it comes in during those cold months. And then as the weather begins to change, as we start to get into spring, you may notice that your mood just naturally lifts. What happens in the spring? The days are longer. We're getting more sunlight. It's warmer outside. People start to, just like the season, and you start to blossom with the season. So people are like, oh, I want to be outside. I want to do things. I want to be active. So another key tip around seasonal affective disorder is, interestingly, it doesn't just occur in the winter months. Some people may get it during the warmer months as well. But when we think about it, it really is a pattern. So it's not just, oh, one day I noticed that my mood is different. It's, oh, every year around October, I notice this steady decline that doesn't lift until March. So that's more seasonal affective disorder. I'll come back and talk about some tips and strategies to help you. All right, y'all, let me know what you think. If you have any questions, put it in the comments.